So Megan, were you joining as a panelist today, or are you part
Nope,
of our audience?
Nope, I'm just part of the audience for today.
Okay, I thought so, but I had to ask.
Kelly did last time too. I'm just here for support.
Thank you. Just going to give it about another minute or so, and then I will get started. Okay, good morning, everyone. Thank you so much for joining us. My name is Lisa Wright. I'm the Health Occupations Coordinator for the School District of Lee County, and we're here today to welcome you for our 10th edition episode of the Career Ed Talks, where today we're going to focus on health sciences. I'm going to go ahead and share the screen so that I can show you our flyer. For our past talks that we've done and our future talks coming up. So we started this past October in 2020 with our Career Ed Talks, and today on the 24th, we have Health Sciences. Thereafter, we have several more talks coming up, and 2 weeks from now, we have Hospitality and Tourism. We want to invite everyone to join those if they would like to. If you can't meet those sessions, they will be available later for you on our Lee County CTE YouTube channel. So we're happy to share that with you, and feel free to share that with others as well. I do want to give a quick shout out to Kelly Thawley, who is our career specialist, and she has coordinated all of the Career Ed Talks for us. And I just want to say, hi, Kelly, we miss you. She's at training this week and wants you all to know that she thanks you for your participation here today. We additionally want to thank our partners in this collaboration, being the School District of Lee County Career and Technical Education, which is us, go ACE, woo! Of course, the Foundation for Lee County Public Schools and the Future Makers Coalition, all of us working together to bring this for us. So thank you to everyone. I'll go ahead and now click over to the DOE Health Science page, which it will show you the courses that we do offer here in Lee County. The core that we have for our health science education programs is the base or the foundation, which starts with anatomy and physiology for health sciences. And then we also have the Health Science Foundations course, which gives the students a background in all of the allied health and how we work together. These are the clusters here, which contain all of the curriculum frameworks for our programs. We do offer allied health assisting, which has the certified medical administrative assistant and also certified phlebotomy technician out of this course. We have biomedical sciences, electrocardiograph technician, emergency medical responder, medical laboratory assisting, medical skills and services, nursing assistant, and also pharmacy technician. We all offer currently here in Lee County. So we're doing a lot of great things, and we're really proud of our students and our teachers here in the district with what we have going. I also want to share with you briefly this health science infographic that's available on the DOE site. It highlights a little bit about what's going on across the state and enrollment numbers here. I was definitely impressed by this myself, but we have 62,500 students enrolled in the state in health science programs here in Florida, 9,500 at the middle school level for a total of about 72,000 students all enrolled in career and technical education. Some of the top certs that we have are Certified Medical Administrative Assistant, EKG Technician, Emergency Medical Responder, Nursing Assistant, and also Patient Care Technician. These programs do articulate, and one of the examples that they provide here for articulation pathway to college is for licensed practical nursing, which we do offer in this school district and post-secondary at Cape Coral Technical College and Fort Myers Technical College. So when students complete the LPN program here, it will articulate 10 credits into an Associate of Nursing degree, which will save the student an average of $1,000, which is a nice incentive there to articulate through a pathway. That leads me into doing a little bit of bragging for our district and our teachers, our students at the LPN level in our post-secondary school for Cape Coral Technical College was just voted the best LPN program in Florida for 2021. So that is incredible. We're really proud. We work really hard at that level to get the numbers and the results for the students to put them out there so that they can pass that NCLEX and get that job. And also with that, across the state or across the Southeastern United States for best LPN programs out of 731 schools, Cape Coral Technical College came in at number 9 for the Southeastern United States. So if you have questions later about any of our programs in the post-secondary technical colleges, please let us know. We're happy to get you in with an admissions specialist and tell you all about the wonderful programs that we have here in the county. See if I can stop sharing now. And I would like to go ahead and give you the opportunity now, please, for our panelists to introduce yourselves. If you could tell us your names and where you work and what your role is. Like, what is a typical day for you where you work? And let's see, does someone want to volunteer to go first, or should I just go around and ask you one by one?
Lisa, I can go first. I don't mind.
Thanks, Jennifer.
You're welcome. My name is Jennifer Kraft. I work with Lee Health. I am one of the clinical education managers within our system-wide clinical learning department. So what that means is I oversee 4 system big programs. So I oversee our nurse residency program, our system nursing orientation. It's called Patient Care Services Orientation, where we provide orientation to our RNs, LPNs, and CNAs and unlicensed staff. And then I also oversee student coordination, and I'm just starting to oversee a CNA advancement and development program as well.
Thank you, Jennifer.
Hi, my name is Diana Elnemr, and I'm the Director of Pharmacy at Golisano Children's Hospital. I do oversee the pharmacy technicians and the pharmacists and the operations, that collaboration between pharmacy and all the other departments. We work on competencies and what's best practice. So a typical day for me would be really overseeing operations in pharmacy and also collaborating with the medical nurses team and making sure that we're meeting the patient's needs.
Thank you, Diana.
My turn?
Yes, hi, Matt.
Hi everyone. My name is Matt Vidal. I'm the staff coordinator for Lee Health Heart Central. My department's in charge of analyzing patients' heart rhythms and identifying any abnormalities so that the patient may have a safe outcome. A typical day for my department, I wouldn't say for me because my job is very specific, but for my department, you would be sitting in a room and watching the monitors and calling the nurses and verifying that the patient's safe.
Thank you. Okay, so next, if you could please tell us about where you went to school, you got your degree, what did you study, and what certifications do you have? How did you get where you're at now?
Okay, I can go ahead and take that one first. I've actually been with the health system for 22 years now. I originally, when I started, it was January of 1999, and I was in nursing school. And at the time I was going to, it was called Edison Community College at the time. That's how long ago it was. It's FSW, or FSW now. So I worked there as a patient care technician until I got my nursing license. And then I went back to school immediately to FGCU and received my BSN, my bachelor's degree in nursing. I stayed on the floor that I had worked on and became a supervisor. Once I had gotten my bachelor's degree, then I decided I wanted to go back and get my master's degree in nursing education, which I also did through FGCU. And I received that degree in 2007. So then I went on to become an educator. within the system for a number of years. I then transitioned into a nursing director role for about 5 years. And then I then transferred into the position within our nurse residency program called the Resident Development Specialist. And it was during that time when I actually got certified as a nursing professional development specialist certification. So I was in that role for about 5 years, and then I just transferred into my current role a year ago. So that is kind of my background.
Thank you.
Okay, so I actually started I took some prerequisites for pharmacy school through Florida WCU, and then I enrolled in the University of Florida pharmacy program, and I graduated in 2008 with a doctorate of pharmacy degree. During school, I completed one of my clinical rotation at Lee Health. My preceptor was an infectious disease pharmacist, and I really loved the system, and I actually got a job right after graduation with Health Park Medical Center, which is part of Lee Health, as a clinical pharmacist in ICU and med-surg. Few years after that, I liked the leadership path, and I started taking some classes in Pharmacy Leadership Academy, and there was a supervisor position in pediatric world that opened up, and I took this position. I love pediatrics, and then Golisano opened up, and I doctor's position. I am completing a master's of business administration as well right now, graduating the end of this year.
Thank you.
I started a little differently. I started right out of high school with Lee Health. I first started as a patient transporter. From then, I transferred to the emergency department as a monitor technician and got certified through the health system. And the cool thing about my department is that you don't need a certification right off the bat. We hire in all different categories. We hire paramedics, we hire cardiovascular students, we hire nursing students, and it just gives them a way in. So I started in the emergency department, and we transitioned into merging into Heart Central. Within Heart Central, I became the clinical lead system-wide for all the emergency departments. And now I am the staff coordinator. I have international certification in rhythm analysis, but we do our own certification within our health system for our new staff.
Thank you. So we talked to the kids a lot about having passion and going after that in your lives and fostering that as you move forward professionally. Could you share with us something that you were passionate about and how you have made so that you can incorporate that into your career?
Sure, I'll go. So really what kind of drove me into this career was when I was 16 years old, and I was in high school, and I was doing some volunteering with my grandmother. And I volunteered at Big-Croix Hospital in the OB department. And, you know, I just was watching the nurses, and I just kind of fell in love with what they did, and, you know, how compassionate they were. And it was just such an amazing atmosphere. So it was really at that time at 16, when I started volunteering, that's, you know, what really developed my passion for nursing. And that's why I chose to pursue that.
What really inspired me into the medical field is my dad. He was a physician, and I saw how much he helped people and how much he can really, you know, make someone happy, make them feel better. And I really loved his passion and his respect towards his patients. And right off the bat, growing up, I saw myself wanting to help patients somehow. And then I got introduced to the pharmacy and all the, you know, what is pharmacy about, and about medications and how to optimize patients on their own medications and how to help them. So I really liked that path. And the more I learned about pharmacy, I saw all the different fields that pharmacists and pharmacy technicians can enroll in and different ways to help others.
I've always been in love with the medical field since I was little, but I never thought I was smart enough to become, a healthcare professional. I would always joke around, like, who would want me to take care of them or things like that. It wasn't till about senior year of high school when I really decided, I could do this. And I tried other jobs out of high school and nothing made sense for me. At that point, I then decided I wanted to be a lawyer. And I just woke up one day and said, I don't see myself going to a courtroom and being happy every day. So that's when I got the job in the hospital, and it all started.
I think we lost your audio. Can you hear me, Matt?
To make sure our patients are safe in our hospitals and outside of our hospitals, and all that just resonates with me.
Thank you. So with our high school students, sometimes they go in and they think, what do I want to do? They feel a little bit lost, or they get in their classes and they feel, why am I learning this? I don't know that this is going to apply for my future. What's the sense in that? Can you think of something to share with us that you maybe learned in high school that helped to prepare you for this field? And that could be either professionally or interpersonally.
I think for me, what really helped me were, I always loved science. So any of the science classes were, really exciting. And, again, that kind of helped me drive, to the field that I'm in now. But a lot, I guess math was one of those subjects for me that I was like, oh, what am I going to need this for? Geometry and all this trigonometry and things like that. And, it is amazing that it can tie back. Now I'm using statistics was another, but now with in my current role, what we have to do, collecting data, analyzing the data, to show our outcomes, and how successful our programs are, you have to utilize that stuff. So, way back when I was in high school, there was a lot of these things where I'm like, oh, I can't just see where this is going to be relevant. And it does kind of find a way to turn up and you're like, oh, yeah, okay. So that's why now I just have to relearn it again.
For me, just like Jennifer mentioned that, yes, sometimes it doesn't make sense at that time when I'm learning that class, but it always came back to use this class, either during professional school, undergrad, grad, or during your life, practical life. There are so many opportunities out there, and if you don't really get the basic science of those classes, you miss out on those opportunities. Also, I knew that some classes were not my passion, but I had to take them because that was a step closer to my goal. So keeping my eye on the goal and where I want to be really helped me keep going. Some, as you start high school, you see that not as long, how many years left, and then college, and, you feel it's long, but it really goes by fast if you keep your eyes on the goal.
I agree with my previous speaker said. An example that's fresh on my mind is freshman year of high school. We had, back then it used to be called Freshman Success. And part of that class was to take Microsoft Word, PowerPoint, and Excel classes. And at the time, I didn't care for Excel. Why would I need Excel? And now in my current role, all I do is look at Excels, look at data. So just because something at that moment in time doesn't make sense, take the opportunity to learn what you can, because you will eventually need it. So that, to me, that's, I think my biggest advice is, yes, that class might be boring. It doesn't make any sense why you need to take it for now, but you will see it in the end, why you had to do what you have to do.
I agree, definitely. And so as far as working with people and getting along, can you tell us what personality traits that you think work well in your career field?
Well, speaking, with nursing and what I've been involved in, I mean, the personality traits, you really just you have to learn to be flexible. You have to really learn to be able to communicate with all different types of people and their personalities. And, you will work with people that, you may normally not go and hang out with, but you need to have a relationship with them at work so that, you're being successful, your patients are being cared for. So it's learning how to communicate and be flexible, especially with people that we may not, be able to get along with outside of the work environment. So, that's really been, that's been a key thing that, anytime I talk to any students, anywhere, whether they're nursing students or CNA students or my own children, I tell them that, you just have to have, flexibility and be able to adjust and then communicate. Communication is key in order to be successful, in anything that you do, whether it's school, work, personal life. So.
Yes, I agree with Jennifer. Being flexible in communication is two important traits, I would say, in the healthcare. Communication is needed everywhere, between your coworkers, between you and the patients, between you and the different teams. So this is, professional communication is really needed. Also being professional and transparent in your in your relationships and in your workflow. You'll learn that admitting mistakes are needed and wanted, and you learn from your mistakes, and this is how you grow.
I echo what you guys have said. And one thing I want to add is about being driven. I find that the best professionals in healthcare are not the ones that are just going to sit to the side and wait for something to come to them. They're driven to care for the patient and to see what the patient truly needs and not just wait there for someone to tell them what to do. And as far as personalities, we all go to school with people that, again, you wouldn't necessarily hang out with outside of that environment, but that level of professionalism that you're there, not because you're there to hang out with someone, you're there to care for the patient. So learning how to separate that and go about it your day, I think that's key as well.
Absolutely. All great tips for our students to pay attention to when they're looking to enter the field. We know that personality is big. It's very important for sure. So looking forward to the future, what workforce gaps are you trying to fill in your industry right now?
Well, our biggest gap right now, as probably a lot of people are probably aware, is staffing. We have a huge gap with, the need for CNAs and nurses and, a lot of different, ancillary departments within the healthcare system. COVID put a whole new spin on, what happened in healthcare this past year. And so we're still trying to recover and figure out what is, how to best move forward. But in addition, we've lost a lot of staff in multiple areas. So that's really a big challenge and a big gap that we face right now is, trying to recruit new talent, into healthcare and then retain that talent over the next several years. So that's what I see as the gap.
Our gap in pharmacy, I would say the need for pharmacy technicians to find a good candidate for pharmacy technician training and getting fit to the job is hard. The market for pharmacy technician is pretty hard right now.
Speaking on behalf of my department, because we are an entry-level department and we hire a lot of nursing students, respiratory therapy students, pharmacy tech students, while they're waiting to get all their certifications to do the job that they went to school for, we are constantly hiring because we're constantly having those employees finish their education, which is amazing. So we don't mind all the hiring and all the interviews. So the gap for us is, it's a happy thing because we see that our staff is moving up and, bettering themselves. So for us, we're constantly hiring and constantly training, but it's a happy thing for us. But I do agree that, COVID has put a whole new spin on healthcare, and something that we rarely talk about too is the burnout. And I feel like at least a lot of my friends that are nurses and doctors, they feel that burnout because of the everything that's happening right now. And I hope that it doesn't create a bigger gap in the employment for these professionals.
Absolutely, definitely. And Matt, I like how you mentioned hiring right out of high school, because our students are always looking and they really need those opportunities. Several of them, they graduate and it's there on their own right away and they need a job. And so having them placed in CTE does definitely help them get a leg up in the world and get a fresh start. So now I know we can send them over to you after they get their
Absolutely.
EKG certifications for a start right out of high school.
Absolutely. We are always looking. I actually have 7 interviews tomorrow.
7 interviews tomorrow.
7
Wow.
interviews.
I guess we know what you're doing then all day, probably, huh?
Yeah.
Okay, so again, with moving forward in the future, what do you think your profession is going to look like 5 years from now?
Wow. I have no idea. I just know it constantly evolves. It's ever changing, and that's something, just in life. I mean, we always have to deal with changes, but especially in healthcare. I mean, with technology advancements and patients and demographics, and patients are living longer and they're sicker, and so just as far as the nursing perspective and CNA perspective, caring for those patients on the unit, I just continue to see that they're just going to keep being the sicker of the sick, being on more of our general med-surg units versus being in an ICU, because that's just how the trend has been going. So, but I think technology will hopefully play a part in that, if not to help with the current healthcare crisis, but maybe to even drive people to become more healthier, so that they don't end up needing so much healthcare services. So, but I'm not sure. It'll be exciting to see what does happen in the next several years.
Yes, for pharmacy, I think it's the more clinical aspect of it that's really developing with some of the laws and regulations with healthcare status and things like that we're waiting on. So how I see it now that, maybe every patient will have their own healthcare provider, but also their own pharmacist for counseling and medication questions and things of that aspect. So medication therapy management, per se, also transition of care. How can we discharge patients from the hospital safely home and follow up on them so they don't get admitted again to the hospital? And how do we make sure that they are taking their medications and understanding how to take them when they are by themselves at home?
Personally, for me, in 5 years, I hope I'm in grad school by then. But for my department, we deal directly with patients with heart disease, and unfortunately, heart disease is one of the main causes of death in our country. And hopefully with all the education that we're putting forward and, technology, the way we're going, how medicine advances every day, hopefully we can decrease that. But I still see us being around in 5 years.
Yes, I definitely think that we have job security in healthcare, very high demand, and our people need us, our patients need us, don't they? Can you share next with us, what was your first job?
Well, my first job was actually when I was like 12 years old. I was a baby. That's kind of how I started. I did that for a couple of years, but when I got into high school, I actually started working at McDonald's, and I did that until I graduated. So.
My first job I was actually doing right after high school. So it was undergrad school, and I used to work in customer service in a retail store called Albertsons. It's not around anymore, but I used to work in the customer service field and that film developing. And I stayed with this job until I started pharmacy school, and then after that, I worked as a pharmacy technician during school.
My first job was working in a hotel laundry room, and that was a part-time I had on the weekends while I was in high school. After I graduated high school, I moved up to the front desk, and I stayed there for a few months before I got the hospital job.
Very nice. My first job was at babysitting as well, and then I worked at Wendy's. My best friend's mother was the manager, and she got me a job there. So it's always interesting to look back at where we started and where we are now. Do you feel that any jobs or experiences that you've had have helped to get you where you're at now?
Honestly, I think they all have. You know, you learn and you take with you pieces from every experience that you have. You know, whether it's a job or school. So yeah, I mean, even though I've had, you know, random jobs like working at McDonald's, I mean, it taught me about, you know, customer service skills and communication, and, you know, so there's always a part of a job that you take with you then to the next, and you just kind of build. And then that just becomes a part of you. So yeah, it certainly does.
Yes, I agree. All your past experiences and all the experiences you gain throughout the way, really that's what shapes you and delivers into your final personality. So even working at customer service helped me tremendously dealing with others and how to be professional, how to be respectful. And this is something needed. I didn't learn it during school, but I learned it early on that prepared me for my job. Same thing for school. I learned how to, how to discipline myself and how to have a goal and how to accomplish my goal, how to put a task list, and that really helped me during my job as well.
I agree. Every experience we have in life, we take something from. So I agree. I think my hospitality job definitely taught me how to talk to people and people of different backgrounds and to understand someone. And especially, you know, not everyone's always having a good day. So just learning how to manage that, I think it's very important for you to take something from every experience you have in your life.
Absolutely. Okay, so last question for us. If you could go back to your 15-year-old self in high school and tell yourself something, what would you say?
Wow. You know, it would really just be, don't give up. There were times where, either, I was in a job that I didn't like, or there was something that, kind of knocked me back down, and I didn't give up, even though there were sometimes I felt like it. And, I guess just saying, life is challenging, it's not easy. So you need to be able to learn how to manage those difficult situations, and just take in everything that you possibly can. Don't think at 15 that you know it all, because you don't. I mean, I'm in my 40s and I'm still learning things every day. So, that's what's important, is just really just take everything in that you learn, whether you agree with it or not, just take it as another perspective. And, because it's really important, and it's really going to help develop and shape who you become. So.
Yeah, I would say enjoy every phase of your life. Sometimes, when I was in high school, some days I thought it was the worst days. When would this get over? And then after that, I thought, oh, I wish I can go back. So take it one step at a time. Don't jump ahead of yourself, and keep your eyes on the goal. Don't get influenced with peer pressure. Be yourself and be determined. So if you have a goal, go for it. Don't let other people discourage you.
When I was in high school, in around 15 to 17 years old, I thought that after high school, things were going to be this magical thing where I could do whatever I wanted and I would have this flexibility to, go wherever I wanted and not have to be accountable for anything. So if I could go back and give myself advice, would be to just enjoy high school, give my best, stop skipping school. It's something you don't think about when you're in that age, but after you grow up and you see it's not going to be like that, you're still going to be accountable, but now you're accountable for yourself, and it's if you don't do it, no one's going to do it for you. No one's there to remind you when an assignment is due. No one's there to hold your hand, so enjoy high school, enjoy your teen years, and just give your best, because I could have been a lot further had I given more of myself during that time. I feel that I did well in school, but I feel like I could have been definitely gone further had I, not skipped as much and given 100% of what I had to give.
So before we say goodbye today, is there anything else you wanted to share, or if anyone has any questions, now would definitely be the time. So we want to thank you very much for joining us and taking your time to share about your life and your passions and your experiences that you've had. It's always very beneficial to look at the people that are sitting in the places that we want to go. And so you definitely influence our students, and we really do appreciate it. Nicole, did I see you raise your hand?
That was an applaud.
Yay! Yes, okay, thank you. But yes, thank you for joining us. And if you ever need us here at Lee County Schools, we're here for you, and we're getting the workforce ready. We're trying to push them out as fast as we can to get them there to you so they can take care of our patients, because we know we need them desperately. All right, so we'll say goodbye.
Thank you so much.
Thank you very much.
Thanks for having us.
Bye-bye.
Yeah.